What is sciatica? What are the common causes of sciatica and what are the most common symptoms of sciatica? I'm Mushtaque Ishaque, orthopaedic consultant at the Priory Hospital here in Birmingham, part of Circle Health Group, the largest private healthcare provider in the UK with over 50 hospitals across the country. Today, I will talk you through everything you need to know about sciatica, including the best treatment options for the condition. So let's begin. What is sciatica? Sciatica is a common condition that causes pain that radiates along the path of your sciatic nerve. Often people talk about pain that radiates through their back or pain that radiates down the leg. Radiating pain in your back or leg might feel like it's starting in one area of your body, such as your back, but shooting off in different directions, such as down your leg. The pain might be constant in some areas and not in others. You might also feel pins and needles or numbness or tingling. The sciatic nerve is the largest nerve in your body. It runs from your lower back, down through your buttocks and into each of your legs. So sciatic pain can be felt anywhere from your lower back down to your feet. The condition happens when your sciatic nerve becomes compressed or irritated. The experience of sciatica varies from person to person. Some people struggle with constant symptoms that interfere massively with their daily life, while others have symptoms that come and go in flare-ups. Often it can affect both your sleep and mobility and can make exercising almost impossible. What are the common causes of sciatica? Sciatica is often caused by a herniated disc, also known as a slip disc, which is where one of your spinal discs moves out of place. This can put pressure on a nerve root. Other causes of sciatica include gradual wear and tear of your spine through localized inflammation near the nerve as a result of aging or overuse. Another common cause is spondylolisthesis, where one vertebra slides forward on the other, catching the nerve, or spinal stenosis, which is narrowing of the part of your spine where the nerves pass through. More rarely, a severe back injury or cancer might cause a sudden displacement of one of your spinal discs, causing severe back and leg pain. What are the most common symptoms of sciatica? The most common symptom of sciatica is pain that radiates down your legs from your lower back. This pain can be sharp, shooting or burning in nature. It can also feel aching and constant in some cases. Other symptoms of sciatica include numbness, tingling, often described as pins and needles, and weakness in your affected leg or foot. The pain may vary in intensity and it can worsen with certain movements like sitting, standing or coughing. You might also experience weakness when bending your knee, difficulty walking on your toes and pain when lifting your legs straight upwards. People who experience sciatica and flare-ups are often triggered by certain exercises or by sitting or standing for long periods of time. Is sciatica serious? Sciatica itself is not typically considered a life-threatening condition, but it can be quite serious in terms of the pain and discomfort it causes. Chronic pain and the other symptoms of sciatica can have a significant impact on your quality of life. How is sciatica diagnosed? Diagnosing sciatica usually involves a thorough review of your medical history and a discussion of your symptoms. Your consultant would do some tests, scans, and a physical examination to confirm your diagnosis and rule out anything more serious. We'll be looking both to confirm that you have sciatica and also, wherever possible, to identify the cause. If you do have an underlying cause that involves a different condition or injury, your doctor will work with you to treat the underlying cause first and the sciatica that occurs as a result. Is running or high impact exercise safe for someone with sciatica? High impact exercises like running can exacerbate sciatica symptoms, increasing inflammation. Low impact exercise like walking and swimming are generally better options for people with sciatica. Yoga and gentle stretching are also good for sciatica, allowing you to stretch your legs and lower back, helping to reduce the symptoms. It's all about finding the right exercise for you, as different people will find relief through different methods. What are the treatment options for sciatica? Treatment for sciatica aims to relieve pain, reduce inflammation, and address the underlying cause of the condition. Some of the most common treatments I recommend to my patients include rest. Take it easy and avoid activities that worsen your pain. This is mostly for people who have less severe sciatica that can come in flare-ups. You might have a good understanding of what causes you to flare, and therefore a better understanding of how much rest you need to take and when to take it. If you are someone who gets flare-ups, but you're not sure what causes them or how to handle them, speak to your doctor about the best ways to track your personal experience of sciatica. Medications. Over-the-counter pain relievers such as paracetamol or ibuprofen can help reduce inflammation and pain, and there are many prescription medications designed to do the same. If your pain and inflammation can be managed, it can allow you to continue with normal life for significant periods of time. Steroid injections. Injecting corticosteroid into the area around the affected nerve can reduce inflammation and alleviate pain. You can get these injections every few months in some cases. Back surgery for sciatica. In severe cases where conservative treatments fail, surgery may be considered to address the underlying issue, such as a herniated disc pressing on the nerve. How long does sciatica last? How long sciatica lasts varies from person to person. 80% of people get better within 6 weeks with rest and medication, whilst others may have symptoms that last longer, even years. It's important to seek advice if you have symptoms for longer than 6 weeks. We will give you recommendations for treatment and management so that you can get your sciatica treated appropriately. How long does it take to recover from sciatica? The recovery time for sciatica varies depending on the underlying cause, the severity of the condition, what treatment you decide to have, and your individual response to treatment. In many cases, sciatica improves with conservative treatments, and this often happens within a few weeks to a few months. However, some cases may require more extended periods of recovery, especially if injections or surgery are required. After treatment, you will work with a physiotherapist to recover and manage your symptoms. Whatever type of treatment you have, your surgeon will give you a personalised estimate of your recovery timeline before you agree to it. Can sciatica be prevented? While it may not be entirely preventable, maintaining good posture, practicing proper body mechanics, exercising regularly to strengthen your core and back muscles, and avoiding activities that strain your lower back can help reduce the risk of developing sciatica. Are there any self-care measures to manage sciatica at home? Ways of managing sciatica at home include performing gentle exercises that don't exacerbate the pain, such as walking, swimming, or yoga. Maintaining good posture to reduce pressure on your lower back and sciatic nerve. Avoiding prolonged sitting, in particular taking breaks and walking around regularly if your job requires long hours of sitting. Sitting at your desk for long periods of time can cause a flare-up. Using proper lifting techniques is crucial. When lifting heavy objects, use your legs and not your back. Is surgery ever used to treat sciatica? Yes, surgery might be considered if you have a severe underlying issue that is causing your sciatica. For example, if you have a herniated disc, spinal stenosis, or any other structural problem in your spine that is causing compression of your sciatic nerve and does not respond to spinal injections. In those cases, surgery might be the best option to treat the problem. We will usually only consider surgery if injections have not successfully helped your symptoms, you have severe pain that is persistent and debilitating, you have progressive neurological symptoms, for example, muscle weakness, or loss of bowel or bladder control. You are struggling with sciatica that has failed to respond to conservative treatments such as physiotherapy over a prolonged period of time and that continues to negatively impact your life. If you are living with sciatica and find the condition debilitating, there is absolutely hope of finding the right effective treatment for you and getting back to everyday life. On a personal note, I suffered from a serious disc herniation in 2019, resulting in severe pain and weakness in my right leg. My ethos is to avoid surgery if possible. I am now back to normal and managed to avoid surgery, and hopefully I can help you do the same. Obviously, if you do need surgery, it is usually very successful and we can help you through this. So, that was a brief run through of sciatica and why you might consider treatment for it. If you want to come and see me for a consultation to talk through your options for treatment or discuss any other lower back issues, you can book online via the link in the description below, or alternatively search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below, as we'd love to hear from you. Otherwise, thanks for watching.